Erase your surgical scars, raise your acne pits, fill in stretch marks, improve the appearance of your scars now.
Did you know that improving the appearance of scars is not a medical claim, it's actually a cosmetic claim? I could legally say that dirt improves the appearance of scars. Also, how can the same product sink raised scars like from surgery and raise sunken scars like stretch marks? That just doesn't make sense. Do you want to know the real way to help scars? I'm board-certified plastic surgeon Dr. Joel Student of ScarGuard Labs. In my 25 years of performing surgery, I've seen just about every kind of scar possible and what happens when you treat them with different products. In the next few minutes, we'll show you the 4 different types of scar products on the market, how to choose one that will actually work for you, and explain why it would be the best choice.
First, onion stuff. Believe it or not, some of today's best-selling scar products are just onion juice. Look at the ingredients. You'll be shocked. Does it help scars? Under a microscope, technically yes. But most plastic surgeons and dermatologists that I know agree with all the studies that showed that rubbing onion stuff onto your scars did not reduce the visible appearance of scars much at all, and in fact, worked no better than a simple lubricant. The second type of scar treatment consists of silicone creams and gels. Silicone helps reduce scar tissue, but only if it creates pressure or entirely surrounds the surface of the scar, called occlusion. Unfortunately, silicone creams and gels are wet, and if you rub them in until they're not a gloppy mess that can get all over your clothing, you are really just rubbing them off. We agree with this published clinical study that showed them to be no better than just using a moisturizer. Using silicone creams and gels that remain a liquid is like putting dinner on the table without cooking it. You've got the right ingredients, but the wrong method. The third type of scar treatment consists of silicone pads. If you actually wear them 24/7 for weeks on end, they work. But are you really going to walk around with patches stuck all over you day after day at work, school, and play? I don't think so. In addition to looking ridiculous, sticking them on, keeping them dry, and getting them to actually stay in place is no easy task. And if you can't realistically use something, it won't work. That brings us to the fourth type of scar treatment. How about a microscopic silicone sheet that is virtually invisible, doesn't wash off, and works better too? The only silicone liquid that paints on and then turns into a solid silicone sheet is ScarGuard. No other scar product can do that, because ScarGuard has that patented. So look out for imposters. ScarGuard gives you the silicone, which studies agree helps scars. It paints on, dries in seconds, and forms a nanofilm less than 1/5 the thickness of a single human skin cell. That's amazing. When it dries, ScarGuard occludes the scar completely because it's biomechanically bonded with the surface architecture of the skin. Unlike big, ugly silicone sheets, it does not need tape or adhesive to stay in place. It is a microsheet like a second skin. For the first 10 seconds, it'll smell like the doctor's office. That's important because it's cleaning the skin. You don't want dirt and bacteria underneath your silicone. The smell disappears after 10 seconds or so, but the protection lasts. ScarGuard is so reliable, you can bathe or play sports and it won't come off. It's so thin and clear, you can even wear it under your makeup. It's scar management that works for your scar and your day-to-day life, so you can actually use it. This microscopic silicone sheet lasts until you gently lift it off by touching a piece of cellophane tape like Scotch tape to it. If you look, you'll actually see your nanofilm on the tape now instead of your skin. ScarGuard works so well though that I have to issue a warning. Look at the scar and don't use ScarGuard on a sunken scar. If your scar goes in instead of out, either live with it or see a plastic surgeon or dermatologist. You certainly don't want to shrink a scar more if it's already sunken. And please, don't believe those products that promise to sell you the sun, the moon, and the stars. There are products out there that promise to help old scars, new scars, acne scars, and stretch marks. How can the same product raise a sunken scar, like an acne scar or stretch mark, and also sink a raised scar? They're opposite problems. So when choosing between onion extract, silicone gels, silicone sheets, or the ScarGuard silicone nanofilm, the choice is pretty clear. Get the same product that plastic surgeons and dermatologists have been choosing for decades because it actually works. ScarGuard.